My name is Eric Statler. I am a 9-year stage 4 metastatic oral cancer survivor. Head, neck, and oral cancers are historically difficult to detect. Survival rates in head and neck cancer are really low. So early detection and prevention is imperative.
Oral cancer is a particularly dangerous type of cancer because by the time it's detected, most of the time it's already metastasized. It is painless to begin with, and it comes in many forms, and that makes it very, very difficult to diagnose. Dentists see patients on a regular basis, much as 2-3 times a year. And I have a personal policy of screening each and every time I see a patient. It doesn't take that long, but it may save their life.
So when you're talking about screening for HPV-related head and neck cancers, your dentists are imperative. They're the most educated about the disease, and they see 83% of our population before the age of 17.
AGD's particular work on preventing oral cancers through the oral examination process that happens in a dental office, and combine that message with getting your kids vaccinated to prevent HPV-related oral cancers.
Oral cancers specifically are tobacco, alcohol, and HPV. HPV, when you look at the numbers, it's the fastest growing demographic, the fastest cause of head and neck cancers and oral cancers.
There's a commonality and a shared goal of wanting to prevent a very serious form of cancer. In this particular case, it's oral cancer caused by the HPV virus.
The message that we're trying to get out to the patients is that the vaccine exists. I mean, if I were to ask you if there was a vaccine to prevent cancer, would you be vaccinated? And I think the majority of people would say, yeah. Well, guess what? There is a vaccine against HPV-related illnesses.
Kids of the age range of 11 to 13 are in the dental chair a lot more often, in some cases, than they are in a pediatric office. So we look and view the relationships that we have with dentists as being a key strategic partner in the message and the advocacy about wanting to get kids vaccinated. And we view a strong recommendation by a dental provider as important as a recommendation from a doctor or a pediatrician to get children vaccinated.
Now, the reason why it makes sense for all of us, including dentists and doctors, to work together to promote this is we all have access to young kids in our practices. We do as otolaryngologists, dentists do, pediatricians do, primary care doctors do. So we should all be working together to push this. And if we can prevent people from suffering through the treatments and the difficulties associated with this by simply getting them vaccinated, it's well worth our efforts to work together towards this goal.
And if you can prevent pain by a vaccine, that makes sense to me. That gives you hope. And in cancer care, hope is sometimes what gets you through.